Hello, I'm Jess Brain, Head of Membership and Communications for National Voices. Thank you to everyone joining us today for the third day of our conference, How Can We Dismantle Health Inequity Together? 2 weeks ago, we kicked off by discussing reframing the conversations around poverty. And last week, for the second session, we discussed mobilising people to combat racial inequality. For both these events, we're delighted to be joined by over 200 people. If you missed either of them, I'd like to watch them. They're available on our YouTube channel alongside the afternoon member-led events. Today, we are focusing on partnering up to combat digital exclusion, an area which has only become more pertinent over the last year, with health, social care, and the VCSE's own services all moving to a predominantly online model. For us at National Voices, ensuring the move to digital works for the people who use health and care services the most is an important and ongoing strand of work. Last year, in partnership with Traverse and Healthwatch, we published The Doctor Will Zoom You Now, a qualitative research study designed to understand the patient experience of remote and virtual consultations. My colleague Savannah will update you at the end of this session on our upcoming digital inclusion project, in which we hope to hear from as many of our members and friends as possible. This morning, we will hear from Hamid Khan, who has personal expertise of what digital exclusion can mean, followed by Emma Stone, Director of Design, Research and Communications at Good Things Foundation, for a take on how we must consider the social aspects of digital exclusion if we are to make progress in addressing it. Finally, we'll hear from James Watson O'Neill, CEO of Sign Health, who established BSL Health Access in response to an urgent need for interpreters as health and care services moved online due to COVID. Before we can get to the substance, please let me go through a little bit of housekeeping. Firstly, we've tried to make this event as accessible and inclusive as possible. Those of you who were here last week and used closed captions, I'd like to apologise. Apparently the issues we had with getting the closed captions up and running were due to a Zoom server being down, and we've been assured that there will not be problems this week. However, I know all too well how stressful it is not being able to access an adjustment you need, and we're really sorry for the issues that occurred. Now, if you feel comfortable doing so, please join me in sharing your pronouns in your Zoom name, as I and many of the National Voices team have done. As you can see on the slide my colleagues have shared, live captions are available for this event. Please click the CC closed captions button at the bottom of the screen on the taskbar, or click in the link in the chat for a fully adjustable page of captions, which are being directly streamed. And I've also been told this is a faster stream of text. There isn't the delay, so that might help you as well. And you can also adjust the page and text color to suit your needs on the live stream. If you have a BSL interpreter, please message my colleague Laura Walsh directly in the chat, and she will spotlight them to the screen next to the speakers. If you would like to do so, please utilise the chat function and introduce yourselves and join in the conversation on there. We will be using the Zoom Q&A function for questions to the panel later on during this webinar. This can be found in the taskbar along with everything else. This week, in order to try and make it slightly more interactive and open, there is a slight difference to how we've worked this previously. All attendees can now view all questions and respond to one another. You can also vote which questions you would like answered up. I will be putting some of the questions you've submitted and voted on to the panel after they have all spoken. We will also have 2 interactive activities using Mentimeter, which those of you who have been to our events in this series before will be familiar with, which will be posted in the chat, and I'll explain them as we go. It's okay if you don't want to do any of this interactive stuff, and if you'd rather just listen to the conversation. Personally, I find too many channels overwhelming and I'd rather just listen to the speakers, but it's entirely up to you how you choose to engage with this webinar. Now, I'm just checking, we've got Hamid Khan here. Hameed, do we have you?
I don't think he's joined.
Okay, in that case, I will go to Emma from the Good Things Foundation, who was billed as our second speaker, but is going to take it away, and we'll hear from Hameed after Emma. Emma, please could you take it away for us?
Brilliant. Thanks ever so much, Jess. And hi, everybody in the National Voices event. So I'm Emma Stone. I work for Good Things Foundation, which is a national digital inclusion charity. And we've been working to close the digital divide for the last 10 years. And this morning, hopefully after me, you're going to hear from Hamid Khan. And I had the privilege of hearing from Hameed some of the things that he was going to say as part of the run through for today's event. And absolutely, I can say that his experiences, the experiences that he talked about for his family and for some of his friends are absolutely far from uncommon. Across the UK, national data that we've got estimates that around 7 million people don't have access to the internet at home. 9 million people can't use the internet at all without support, but many, many more don't have the level of digital access, skills and confidence, which is now expected and has become essential for living and working in the UK. Really importantly, when we talk about the digital divide, we're not talking about a simple yes or no, a kind of binary divide of you have it or you don't have it. We're really talking about a spectrum. And we're also talking about a widening gap between those who can afford fast, reliable access and who have the skills and support to be able to benefit fully from the internet and digital tools, and those who don't. Using the internet should be a choice, but it should be a real choice. And far too many people do not have this. Later this morning, you're also going to be hearing from James and the inspiring work that Sign Health has been doing to harness the power of digital technology to reduce some of the barriers faced by people with hearing impairments and in the deaf community. And what I loved when I heard about Sign Health was that they do a great example of showing how those commissioning, providing, designing digital tools in health or care services need to recognise the barriers and how you can design out inequalities. And the work that Jess just mentioned that National Voices did with Traverse and Health Watch on the Doctor Will Zoom You Now is another reminder that actually one of the things that digital can and does offer should be the chance to kind of improve and respond to feedback. And I think one of the most powerful messages from that piece of work was about how can we keep on harnessing feedback from people who are using services, supporting others to use them in order to improve and design out those inequalities. From our work at Good Things on digital exclusion and from available national data, we know that the barriers and challenges that people face often overlap. So you've been talking already through your event around the links with poverty and around the links with racial inequalities, and absolutely low income, racial inequalities, poor experiences at school, low literacy and health literacy, unemployment, English language barriers, insecure housing and homelessness. All of those factors, along with disability and limiting health conditions, put you at greater risk of being digitally excluded or not benefiting fully from the internet. Age absolutely matters, but across all ages, it is those issues around poverty and other inequalities that matter more. They're the strongest predictors across all ages. Also important to note that this pandemic hasn't created digital exclusion. This is not a new issue, but it absolutely has made digital exclusion and data poverty more visible and more damaging. And that's because using the internet, accessing the internet has become a survival mechanism for so many of us through this pandemic, for every part of our lives. And that links to the slide that I put up here around COVID and the digital divide. Without a doubt, digital access, skills, confidence to use the internet safely is now a social determinant of health. It matters for all those areas which we know are vital for our health and for healthy lives, whether that's about jobs and economic employment, it's about our childhood and education, being able to participate socially, community connectedness. And even when we are able to meet again without social restrictions, what we absolutely know is that this pandemic will have fast forwarded the relationship that we all have with digital technology. It will be brilliant and wonderful to go back to face, but online services and support, that is not going to go away. That is part of how we are going to be providing services, whether you're in the voluntary sector, in the health sector, or whether you're a bank. So that's why I'm so glad you are meeting and talking about digital exclusion today as national voices, because digital exclusion is a problem that we have created through not providing access for everyone, through not providing everyone with the skills and support they need to get online and to use the internet safely. And we have to address that if we want digital to play a part in actually reducing health inequalities and improving health access, not just widening those or increasing the barriers. And I've got no doubt that there are already so many of you in this room who are doing that. And that's so important, because we need to work together to achieve this. And we need the government and the NHS and integrated care systems and GP practices and others to recognise the responsibilities they have and the part that they have to play as well. And I have to say, I was so frustrated and disappointed that in the latest Health and Social Care White Paper, there is lots of reference to data sharing and to the importance of digital and digital transformation, but no mention of digital inclusion and the responsibility that the government and the NHS has in addressing digital inclusion. So that's why, if you can move to the next slide, Jess, that's why we are campaigning to fix the digital divide. And we're working with others to end digital exclusion and end data poverty. It's also why we provide free online learning called Learn My Way, which is designed to support people to take their first and further steps online and build their confidence. And it's also why we support a national network called the Online Centres Network, open and free to any organisation or group, big or small, charity or not, which wants to respond to community needs and make digital inclusion happen. So if you're not a member, think about joining. It's free to join. And if you are a member, that's brilliant. And thank you for the part that you're playing in fixing the digital divide. Back to you, Jess.
Great, thank you very much, Emma. Before we go over to Hameed, I'd like to introduce our first interactive activity, for which we're using Mentimeter. But my colleague should shortly display the question on the screen, I believe, and just put the Mentimeter link in the chat. So the question is, what are the main barriers to accessing digital or virtual care? And if you could all answer that over the next few minutes. I'd now like to introduce our next speaker, Hamid Khan, who has personal experience of digital exclusion and an interest in how to promote digital inclusion and challenge digital exclusion to barriers. Over to you, Hamid. Sorry, Hamid, I think you're on mute.
Sorry about that, already a bad start. Hello, hi, I'm Hamid Khan. I'm an ex-service user of mental health services. I'm currently a carer for my mom who has physical and mental health issues, and I've worked in health and social care field prior to becoming a carer. And I think today I want to really focus on how digital exclusion and inclusion, there's a fine line, and it's very clear cut. Either you are digitally very included or you're digitally excluded. And I want to share a quick example of how life was like before the pandemic. It was very much face-to-face, telephone call, and you would go and see someone at the time you have an appointment. When the pandemic happened, everything changed overnight. I'm a heart failure patient, and my first time experience was that my heart consultant had changed my face-to-face appointment to a video call via Zoom. And I never heard of what Zoom was, never knew what Zoom does. And can you imagine, there must have been many patients like myself who must have received a letter in the post saying, your next appointment is by Zoom, and no one knows what Zoom is. So that was something that when I actually, first time in my life, felt very illiterate. And I started to reflect and start to think about what it must be like for people in the 80s, like my parents, who arrived to the UK and couldn't speak English, how excluded they must have felt just because of language and no other reason. And same way now, most of us can speak good English, maybe very fluent speaking English, but now there's a new level of illiteracy that comes through the digital world. And I wanted to kind of put it in very bold, digital illiteracy, because I have a few friends who are very fluent English speakers, very confident and very articulate. And when they're sitting in a room with face-to-face gathering, you see those level of confidence buzzing. When you actually see them, anything to do with technology, they start to feel very excluded. And sometimes one of my friends said, I know what it's like. I can't imagine it to that level, but I've got a bit of an inclination what it must be like for somebody who has a disability and not have the ability to do something. Because when it comes to technology, I feel very much the same. It's almost like I don't have the ability to do something that requires technology skills. So on that basis, what I'm going to share is the importance of bearing in mind that, first of all, digital exclusion does not mean people who don't speak English, because you can speak English but yet very quickly excluded. Secondly, I want to bring to the forefront the issue about why can't the NHS have only one universal platform that we know that as patients and carers, when we get called, only this is what they're going to be using. So they can create their own version of Zoom or their own version of Microsoft Teams. But what is one of the biggest frustration I found as a patient and carer, that every time somebody rings me, they have a different platform that they want me to use. So I've got to quickly train myself or get to work around Microsoft Teams, Microsoft Teams, Slack, Zoom, WhatsApp, Facebook, or social stuff. So there's so many different ones. And now we've got Asana that somebody's mentioned, another one that's come out, like a project management tool that in some places they want us to use that. So I would like the NHS or NHS England to lead on one, develop one, which is universal and is used across the NHS. So or even one that's used across government sector like social care services and the NHS, because it will make life easy for patients and carers. Also, I want to quickly touch up on privacy and other barriers. There's barriers that we make assumptions that everyone's got devices. We make assumptions that everyone's got Wi-Fi. We make assumptions that everybody is in an environment where privacy can be respected. Sometimes one family member may share a device with 5 other family members, and how data protected are we? I don't want everything about me, my other family members being able to read. So there's also the issue of privacy that we need to take into account, and confidentiality. And all of this, I think that we can't deny and run away from technology, because this is now kind of part of the future. But what we can do is say, we're going to acknowledge that there are people out there that require training, sport, skills, and we also need to acknowledge that there is data poverty for service users and carers, because it costs money to be able to use online platforms. Just like broadband, data on your mobile, or you may have to purchase a dongle. So on that basis, and particularly in the COVID-19, where all public buildings are closed, like you can't access to the free libraries, the community centers, the universities, the colleges, any public domain where you were able to access free Wi-Fi, they are closed. So which means you either need to purchase or you need to be not digitally included. So I want to finish on that basis to say this is a start of a conversation. It's a start of us all coming together to raise these issues. And one of the things I want to mention, I'm part of an organization that I go to their meetings. I'm not part of the organisation, I attend their meetings, and it's called Hear Equality. And they do wonderful stuff around raising these sort of issues at policy level about digital exclusion. Thank you so much.
Thank you, Hameed, for such a practical and insightful look at the issues we're facing. And particularly, I just think the idea of one platform across the NHS is something potentially we could all get behind at the end of this conference. Now, whilst Hameed was speaking, we asked you to contribute your thoughts to our interactive activity. I wonder if my colleague could share the outcomes of that. Great. So the question we asked you all was, what are the main barriers to accessing digital or virtual care? And I'm seeing quite a few things come up there that are around confidence, skills, knowledge, digital literacy. Again, we've got lack of confidence mentioned in there. And then we've got a lot around financial issues. So yeah, cost, money, access, which I suppose could be financial or for a host of other reasons. And then some sort of more social factors such as age, lack of support, awareness. I can't read all the tiny ones, but we'll send it round afterwards so that everyone can have a good look at that. And these will be used to capture a record of the conference. Now, our next digital activity is actually slightly different. We're going to ask you to write on a post-it note, and then we'll read out just a few of the post-it notes afterwards. And we're asking what we can do as the VCSE sector in relation to digital exclusion. And I think so far what you've heard from Emma and Hameed will probably feed into that quite a lot. Now, enough from me, over to our final speaker, and then we will go back to the post-it notes, and there will be chance to address questions to the panel afterwards as well. So please do start putting those in the Q&A. Now, let me introduce James Watson-O'Neill, CEO of Sign Health.
Thanks, Jess. Good morning, everybody. And thank you to National Voices for putting on a really fantastic conference and for inviting us to speak this morning. I'm really grateful to be sharing a platform with Emma and Hameed. I think they've done a really great job of covering such important issues around digital exclusion. I want to talk to you about something slightly different that links to the topic, but takes a slightly different perspective this morning. So I'm James, I'm from the deaf health charity Sign Health. We support deaf people who use British Sign Language to communicate. I'm deaf, I'm accessing captions and streaming audio to my hearing aids, but sign language isn't my first language, whereas it is for almost all of my colleagues. And we found that COVID presented a really significant problem to deaf people and the community that we support. We already know that deaf people's health is much poorer than hearing people's, but the introduction of PPE and particularly face masks, which of course blocks the opportunity to lip read or see facial expression, really significantly increased the access barriers to health for deaf people. And so we were struck very quickly by this significant new barrier for deaf people's health. Can I ask you to put up the first slide, please? That's great, thank you. I'll just read this out because it's not very easy to read. This is a handwritten note that was shared between a clinician and a deaf patient who is in a COVID ward. And the clinician is attempting to communicate with the deaf patient. And they've written on this piece of paper, it is a ventilator / life support. You are put to sleep and a machine breathes for you. Sadly, only 30 to 40% survive, but I think it is very, very, very unlikely you will need. Are you okay with us trying if you do? Sorry, I don't want to scare you. You are doing well. And that's the kind of communication we were seeing about a year ago at the very beginning of COVID, when the crisis first began, and it was very difficult, if not impossible, to get an interpreter in hospital. Thanks. You take the slides back down, please. Thank you. So we were made aware of that issue, and we were really worried about deaf people's access. So we spoke to the company that provides sign language access to NHS 111, which has been around for about 4 or 5 years. It's the only public sector service in England that health service that you can access through sign language. Unlike Scotland, where you can access all public sector services in sign language because they have a Sign Language Act in Scotland. But we spoke to the company Interpreter Now, who deliver that service, and we asked them about the uptake of NHS 111 during the pandemic, and the number of calls they had skyrocketed. But we asked them, would it be possible to develop a service with them using the same technology so that deaf people could get access to interpreters in any health situation? So I've only got one more slide. If you could put that slide up for me, I'll just explain how that works. That's brilliant, thanks so much. So if you're not familiar with video relay services, this is a hopefully helpful graphic. Essentially, the deaf person who's on the left of the screen connects via a webcam to either their phone, a tablet, or a desktop computer. They sign to the interpreter, who's pictured in the middle, and the interpreter then speaks the conversation through a headset to the hearing user on the right-hand side of the screen. And then the hearing user speaks back to the interpreter in the middle, and the interpreter signs the conversation back to the deaf person on the left-hand side of the screen, and backwards and forwards and backwards and forwards. So this kind of technology is quite common. It's been established for more than 10 years. As I say, it's used to deliver the NHS 111 BSL service. And so we worked with the company Interpreter Now, who use this technology to open up access to deaf people to use interpreters in any health setting. Thanks, you can take the slide back down now, thank you. So we created a new service called BSL Health Access. We had our first conversation about that on the Thursday before the Easter weekend, Maunday Thursday, I think that's called. And then the following Thursday, only a week later, we launched our brand new service. So I'm very grateful to my colleagues, some of whom are in the webinar today, for working so hard over the Easter weekend to develop a brand new service. We came up with the brand and the visual identity. We developed a website. We developed frequently asked questions in both English and BSL, and then launched the service on the 16th of April last year. And on our first day, we had more than 100 calls, including from a deaf man who had not previously been able to contact his GP. And since then, we have had thousands and thousands and thousands of calls. We've had more than 25,000 conversations with deaf people during that time, and since the 16th of April, so it's not quite a year old yet. So the service has made a really significant difference to deaf people's ability to access healthcare during a situation where so much went digital so quickly. So that's involved deaf people contacting their GPs. 60% of our calls are to or from GPs, but it's also involved conversations in hospital. The technology can be used to relay a phone call, as that image kind of explained, but actually you can use the technology in person as well. So if you're in a hospital ward, you can use your phone or a tablet computer as an intermediary interpreter if you're in the same room. So it's been a really important service. We have struggled with funding. We expected initially to be able to get funding for that service very easily from NHS England, and I'm very grateful that they have indeed funded the service from December through to the end of this month. We have no certainty about funding after the end of this month, and yet the interpreter service is being used to support deaf people to access vaccination. It's being used to support deaf people to access testing sites, and of course all other healthcare services too. So we're very, very hopeful that funding will continue, but we've got no news yet. Sign Health, we've had to spend £800,000 of our own reserves on delivering this service before we were able to convince NHS England to fund it. And I'm very grateful to my Board of Trustees who agreed over the Easter weekend to pull that much funding out of our limited reserves as a charity to make this vital service available. So I would encourage everybody to think about inclusion when they are considering digital services. That not only includes captions and access to sign language interpreters, but I think it also includes, really at the heart of it, co-creation. If we can work with people who are going to use services, then we can design services that are really, really inclusive. I absolutely agree with what Emma and Hameed have covered in terms of digital exclusion, and not everybody has digital access. But for those people who do, it also has to be accessible in terms of communication and culture. So appreciate the chance to talk this morning and looking forward to questions and answers. Thank you.
Many thanks, James. I can see a lot of comments in the chat reflecting upon particularly the note you shared at the beginning and just how heartbreaking it is, but also what amazing service Sign Health managed to turn around in such a fast time frame and really save lives. We asked you to respond on a post-it what the VCSE sector can do. Hopefully my colleague is able to share this with me now so that we can reflect on them. Lovely. Oh, just wait for Laura to make it big. Lovely. So we can see here some of the things that are coming up: lobby for IT access to all, find ways to connect with those who are currently digitally excluded and ask their opinions. Again, campaign, amplify voices of digital exclusion and highlighting the responsibilities of policymakers and healthcare providers. Open the door to conversations with people. Don't make assumptions that everyone is the same. And that's a message that we've heard on every day of this conference so far from a huge amount of speakers and attendees. Collaborate more to find local solutions and reach more people together. Understand how small voluntary sector organisations can contribute and ensure they are supported and valued to make their contribution. Larger charities can provide financial support to smaller charities, which is something we heard about in one of our member sessions last week on leading community work in terms of combating racial injustice as well. So we're getting a lot of themes going through throughout this conference. Help people to gain the knowledge in their home, run activities online, so more people are using the systems more frequently, and that's something we'll hear about in our member sessions this afternoon. It's the practical things charities have been doing to enable people to access digital tools. Educate service users. I think we're hearing in the chat as well, there's quite a lot about educating health professionals and other people who are working with people trying to access digital services. Link in with other organisations to share information and move with a more united front. Reframe the conversation. So again, coming back to day one of our conference where we talked about reframing conversations around poverty, that's something we can do around digital exclusion as well, and might be a takeaway from this conference. So generally there are a lot about what charities can practically do, but also about what we can do to campaign together, which I think are the two key themes that we've seen on every day so far, and I would expect to be seeing in the final week of our conference when we look back on everything next week. There's more. Raise awareness, not assume. We're seeing that an awful lot about actually talking to people about what the issues are, which is why it's partly so great to hear from Hameed today. So there's someone saying very personally there about what they will be able to do using specific software. And again, we're hearing about outreach. So there's a lot of really valuable things you've all contributed there, and it's great to see so many specific examples of what we can do, but also that everyone's very much on the same page in terms of the dual role of the VCSE sector in campaigning and in actually practical solutions. Great. Should we go on to questions? So the first one is, shouldn't National Voices and others be making an interpreter available for this sort of meeting, which I'll address personally. So when everyone signed up for the conference, we asked what their needs were in terms of reasonable adjustments, and the vast majority of responses we got were that people were potentially had hearing loss or were deaf and could use closed captions. Now we actually have a budget that's quite small for this conference. We had a budget of about £4,000 and we chose to go with a closed captioner because that made the conference accessible to everyone who'd signed up. We do sometimes have one attendee who uses a BSL interpreter who we spotlight, and that is paid for out of an access to work budget. I think James would like to come in on that as well.
Thanks, Jess. Yeah, and just to explain, I know that I have deaf colleagues who are attending the webinar this morning. They're being supported by interpreters who are on separate devices, so they are being supported by an interpreter, but you can't see them. We did have a conversation about potentially spotlighting them, but we perhaps didn't do it quickly enough. But it's always great to see a sign language interpreter in person. Reminds everybody that sign language exists and is a great thing. Yeah, I think with this, we've all got more work to do to evolve how we do online events. But I think you're doing a great job at National Voices. Thank you.
Thank you. You know, we know we're not perfect, but we are trying. Now on to questions to the panel. So there's been a question come through as to local GP practices and their awareness of issues around digital exclusion, and also if it's possible to give them a roadmap to tackling some of these issues. So I just wondered if you could reflect maybe more broadly on how in local areas an understanding can be established by health professionals and maybe wider people such as Universal Credit, can't remember the name, and I think Emma to answer that.
Yeah, sure, Jess. I think as with so many other areas, the practice is really variable. So you will have some examples of GP practices that do understand this, that have been really wanting to try and think through, make things accessible and are very conscious of digital exclusion, and others actually where you've got issues around lack of digital skills and confidence within the GP practice itself as well. So I think there's, you know, just because you're in the workforce doesn't mean that actually these aren't really important issues for you too. In some of the work that we've been supporting at Good Things Foundation, we've been working with community organisations and to see about how they might play their role. They're already supporting people with digital inclusion. How might they support people to access health tools, health resources, NHS website, etc. And actually, it's quite, it is really worrying how difficult it is for community organisations still to be able to develop those links with GP practices. So almost that feels like the bigger part of the problem. There's both the recognition within, say, a GP practice, but there's actually also who's doing that reaching out and that linking over. Social prescribers in some areas, link workers in some areas. I know that from the National Association of Link Workers that digital exclusion has come up as more as an issue for them. But I'm still not aware that there is anything really systematic and coordinated that is going on around empowering and enabling link workers to be able to understand more and to be able to make those connections with, and it is often community organisations who are under-resourced but brilliantly well placed, have the trust of local communities and could provide that support and be that kind of bridge in with GPs. So and the same goes with Job Centre Plus, the same goes with kind of, you know, others that are part of that wider support system. So it is why one of the things that we're campaigning for is more resource to be able to have more community organisations that can provide that role and can provide that support. And I know that you've got people in the room, so John from Belong in Nottingham, you know, it's exactly the sort of work they do. Rachel from 100% Digital Leads, where I think they've also taken a more strategic approach as well. So there are loads of pockets of good practice, but the problem is they're all pockets, and it's still really hard for community organisations to get the recognition and the resources they need from the health and care sector.
Thank you, Emma. Hameed?
Yes, please. And I think it's a very good question. What I would like to say is that GP practices are probably also taking into account where they're based and who their makeup of patients are. So it's a double-edged sword in the sense that they may be in a place where they got in a city very older South Asian population. Let's give an example. We don't have digital skills, but yet they might make assumption that all patients, let's just use the traditional way, and that's the telephone. But actually, they may have a lot of young people also on their patients who are very digitally included and like digital way of communicating. So that you've got that aspect, or you may end up having a GP practice in a very middle class, affluent area where they make assumptions that everyone must have digital literacy skills and everyone must have broadband at home and everyone must be, and yet there may be people or pockets of people living in those areas that haven't got access to either digital platform or broadband, or they may not have skills. So the question is that how do we create a fairness? And I think just like we get questions asked by GP practice, for example, who's your next of kin in case of emergency? Why can't they have a new question on a form that says, how digitally competent are you? And then what happens is that when the GP makes an appointment, when you reach out to the GP and you're going to have an appointment using technology, they could just know straight away, this person is a mobile call, this person is a Zoom video call, this person is quite happy with just email me their symptoms and I reply back the symptoms. So I think we need to have something like that which really shows the GP which is the best possible way to reach out using digital technologies to people. Like my mom, she's perfect. You just give her a call on the landline and she'll pick it up and she'll say hello and she'll tell you what the situation is. I like the GP to be able to see me, not to hear my voice. I want them to see my facial complexion, my body language. Sometimes when you're not feeling well, you give a lot off the face. And I want the GP to make an accurate diagnosis rather than just go by what I'm saying on the phone to him. So this is what I would like to, the point I'm making is, let's have GPs for every patient have one line that says something about digital inclusion and they know how they can contact you and they know your level of digital skills. Thank you.
Thank you, Hameed. That seems like the definition of personalised care to me. James, do you like to come in on this?
Yeah, I absolutely agree. I think it's about power. I think it's about if the system really respects the power that the patient has, the person has, and they really respect them as a customer, a consumer, somebody who can take their business elsewhere, all of those sorts of things, then you start to see the system really beginning to work towards the person with the power. So that is absolutely about person-centered care. That's about knowing what the choice that, as Hameed said, the choice of individual people to communicate in particular ways. We do that at Sign Health. We run the only accessible IAPT service, improving access to psychological therapy service, that's delivered by my colleagues directly in sign language by deaf people to deaf people. And we now deliver that service 100% digitally. We used to have a single platform that you had to use. And then our clients were telling us, actually, I want to use WhatsApp, or I want to use Zoom, or I want to use Teams. So now we respond and we deliver the service through the platform that the person wants to use. So we take the responsibility to adapt our practice to suit the person. And I think that's a really good example. I have nothing to do with that. It's just my fantastic colleagues doing it. I think it's a really good example of people adapting to where the power is.
Great, thank you. And then another question, which I think is a really brilliant question. What role does stigma play in preventing system leaders and politicians tackling digital exclusion for all communities, not just the most obvious? And I'd like to put this to Hameed first, please.
I think the word stigma is so broad in its own right, and we could probably have a whole conference just on the word stigma. But I think what social platforms, digital platforms have done is stigmatize people more than what they were. So for example, I've always said is that I went to a project in Romania and we were from 8 different countries and we were looking at the time literacy, and it was just about how literacy can either give you a very good strength in the political world or it can actually make you feel very disempowered. And that was just about people who can read and write. And I'm going to take that out into this context. Now, the way things are going and moving forward, if you don't have digital skills, you are very much marginalized, because even now, a lot of the political arenas and things that take place, that they expect that you have skills to do it online, like online voting. But if they started doing that or encouraging that, my mom is totally straight away socially excluded, because first, language is a big barrier for her, and then on top of that, digital incompetence. And secondly, that causes a lot of strain and stress for family members who have to then help their family members to navigate or do things on their behalf. And then the question comes is, how independent are they? Because I could just vote the party I want to vote rather than let my mom make the choice. But because I've got the control over voting for her or into the online system. So where I would like to go from here and say is that if we're going to really challenge and tackle stigma in general, then the first point is to say we want more politicians to get serious about taking this digital exclusion very seriously as its own entity and putting a vocal voice out. And then we want adequate funding to challenge, because what I would like to say is something very ambitious, that I would love to have a clear slogan that says by 2030, no one will be digitally excluded. That would be super amazing, but at least we know the government is working towards something. So my message is, this is great that we come together to talk about these things openly, but don't stop here. Take this message out to people who hold powers to take it serious. Thank you.
Thank you. James, would you like to?
Yeah, I think someone mentioned it either in the chat or the questions, but there's a perfect example for me of stigma in the way that the government has handled the pandemic. We still see no in-person British Sign Language interpreter at the Downing Street briefings. And even the photographs that were shared yesterday of the new briefing room that I think cost £2.5 million, it's not clear that a BSL interpreter will have space to stand on that stage either necessarily. And what that does is that makes deaf people and British Sign Language invisible. And so a lot of this, I think, is about visibility, is about people being aware, people having it in their quote unquote normal world, what the expectation is, how used to things people are. And I think there's a really important link between stigma and invisibility, visibility. We at Sign Health, we have summarized every single Downing Street briefing into sign language, and I think there are about 160 of them. That is not our job, and yet we have to do it because the government isn't doing a good enough job. I think it's really important that we call that stuff out again and again and again, and we don't begin to accept it, because it's stigma and it's wrong, and we need to work together to achieve the equity that we're all focused on in this conference.
Thank you. And finally, Emma, to you.
Yeah, so really echo what both Hameed and James have said. I think, and Hameed, I really agree. We talk about already, we say that we should be aiming for 100% digitally included UK. So that's kind of something that we feel is really important, which isn't the same as saying that means everyone should have to. As I say, it's about choice, but it is important. And I think one of the problems that we also have, and it links to the visibility and visibility, is that it is a classic example, I think, of people who are decision makers not really understanding and not taking the time to listen and see the reality of digital exclusion. And it can be quite complicated, because sometimes, the national data will say actually there's still a vast majority of people who do have some form of internet access. They might not have it at home, they might not be able to afford it, it might not be reliable, etc., etc. But I think almost we are entering this quite complicated territory now of going, it's not just the access. The access is vital. We know there are people and places who don't have it, but it's more than that. Even when you have access, there are other ways in which digital exclusion locks you out. And so I think, how we manage to make that case, tell those stories, and also point to the benefits that people can get when they are able to use digital technology. There's something called the Matthew effect, which is basically the more you have, the more you're then able to get, right? So the gap widens and widens and widens. So the more digitally enabled and digitally literate and digitally supported I am, it's cheaper to live my life because I can access deals online, I can access, you know, whatever benefits I need, I can get money, advice, I can get peer support, you know, all of those things accrue to me if I'm digitally enabled. And that's the big risk that we have here. Not only in relation to health, but in relation, as I said, to all of the areas of our lives that matter for us to be flourishing human beings.
Thank you. Now, we just have a few minutes left for the last question. How, as a group of charities and people who support this cause, do we best advocate for digital inclusion? And I'd like James to answer that first, please.
My answer, I guess, to that question is similar to my answer to lots of other questions about how the charity sector should do stuff, and that's about working together and compromising and giving away power. You know, we know at Sign Health we will not succeed on our own. We're a very specialist organisation focused on a very particular community. We absolutely want to work in partnership with everybody because that's how we'll deliver our purpose. And I think, you know, the same goes across the sector. We have to work together and realise a kind of higher aim.
And Emma?
Yeah, so as I said earlier, it is about working together, and it is about being able to advocate to you know, advocate in terms of the responsibility that the government and the NHS and others have to take, but also recognise the responsibilities that we all have towards supporting people in their digital inclusion. So yes, and one of my actions I put in your spreadsheet is I really want to explore with National Voices how we can do better linking across with Good Things and the Online Centres network on this.
Yeah.
So, yeah.
We absolutely want to link with you, and I think everyone here, I hope, does as well. Hameed, would you like the last say on this question?
Just very quickly, going to give a very quick analogy. What I was very surprised me, I was in Armenia for another training course, and I walked through a public park, and somebody said to me, a local Armenian, "Oh, you can get free Wi-Fi in the park." And I was like, "What do you mean?" And he said, "Well, in our country, across all public parks, it's free Wi-Fi." And I said, "Who funds it?" And he said, "We have a very rich Armenian singer who lives in America, and he funds this as a way of giving back to his country." And I just took that model and thought, why can't we have the same thing in the UK? And I've been saying this to many different platforms where we're talking about digital inclusion, that I want to see free Wi-Fi across the country, and not based on you need broadband, just like you pay council tax. I don't mind paying 50 quid extra a year, knowing that every household, every public park, every street has free Wi-Fi. And this could be one way of going forward to create a Wi-Fi free country, because we could actually pioneer that and say we're one of the leading countries doing that. And if Armenia can do it, a small country which doesn't have not very strong economically, why can't we do it? And I would like to hear what others think of my amazing initiative, because I really love to see that happen in reality. And I think the voluntary sector, the charity sector are fantastic. The fact that we're not afraid to speak up, we're not afraid to voice our opinion, we're not afraid by statutory bureaucracy. So let's get together and put these kind of forward. Thank you.
Thank you. I think that's a great idea to campaign for, and I'm sure others will feed back to you in the chat. Well, thank you all for coming today. Just before we go, I'm going to hand over to my colleague Savannah, who is running our project on digital, I think we're calling it digital inclusion, over the next few months, and she'd like to offer you all the next opportunity to get involved. Thank you.
Hi all. So as Jess said, I'm Savannah from National Voices. I just want to say thank you so much for all the speakers, Hameed, James, Emma, and Jess for chairing. It's been really, really fantastic to hear all of your different perspectives on digital exclusion. One thing that really stood out for me was, Hameed, what you said at the beginning about being told now your appointments on Zoom, an assumption being made that you knew what that was, and how that makes people feel completely illiterate, and the comparison to digital exclusion and language barrier. And I thought that was really interesting. And I've read in the chat people calling for Hameed to be Prime Minister. So I think other people agreed as well. What I've heard loud and clear over this past hour is that we cannot make assumptions when it comes to digital exclusion. We know in health and care generally that homogenizing communities and making assumptions is dangerous. And National Voice's mission is about democratizing and personalizing care. And that's because quality care is personalized care. And personalized care means, as James said and others have said, offering choice of how people engage in care at every single stage. And it means listening to communities and people and listening to their different needs. We can't make assumptions about digital exclusion because, as Emma said, it's not a clear-cut divide between those who are online and those who are excluded. It's probably better understood as a chain, which includes confidence, skills, training, resources, privacy, safety, and more. So true inclusion means tackling every single one of those barriers and more. And it means thinking upstream. Digital exclusion is something that we're focusing on in this conference because it is absolutely central to health inequity. And that's because it sits at the intersection of so many inequalities. And these inequalities mount on top of one another, as we've said. And we've talked about lots of the different intersecting inequalities over this conference, some of which we've spoken today. Emma was talking about the Matthew effect, which was really interesting. And James was talking about accessibility issues for those with hearing impairments when that shift to digital happens. And on day one, we talked about poverty, which is obviously intertwined with digital exclusion. If you're digitally excluded, you're less likely to be able to access universal credit. Your employment options are affected. So what's very clear is that we can't tackle health inequities in silos. So digital exclusion is obviously a massive priority for our sector. And therefore it's a big priority for National Voices at the moment. So as Jess said, we are running a project on the digital front door of the NHS. It is NHS funded. We've been working with charities, with research organisations, and we're expecting there to be 4 key outputs, which I've just explained really briefly. So one is field work. So we've been conducting loads of interviews with people who are most at risk of exclusion. Not hard to reach communities, but easily ignored communities, as we're calling them instead. So that's the first one, fieldwork. Secondly, an innovation catalogue, which is essentially showcasing all of the fantastic work that the VCSE sector has done over the last year to try and combat exclusion. 3 is inclusion principles, mainly aimed at system designers. And the 4th output of this work will be patient-facing material, as accessible and clear communication to patients is just everything. So combating digital exclusion is clearly really complex, but one role we do have as a sector is to facilitate positive conversations around digital tools, and also to be open and honest about the limitations that those digital tools have. And those are exactly the kind of conversations that we're hoping to facilitate this afternoon. So at 1 o'clock, the Patient Information Forum and Connected Nottinghamshire are doing a workshop. And at 2:15, there's a workshop with members Compassion in Dying, Macmillan and Future Care Capital on the human within the digital. And that'll be all about using storytelling ethically, keeping the person at the centre of their own story, and using that storytelling online to influence policy and also to improve healthcare outcomes. So it should be interesting. So do stay in touch. We are sharing a spreadsheet where you can share contacts with one another, and we always want to hear from our members. And do please attend next week's session, which is on how we can together take action and what we do next as a sector. And yeah, we hope to see you this afternoon. So thank you so much to our speakers, and thank you so much to everyone who's attended today and over the rest of the conference.